Now turning to our program, please welcome Holly Botsford, Director of Marketing Communications of the Medical College of Wisconsin, to introduce today's speaker.
Good afternoon. It is my honor to introduce a leader whose influence extends far beyond the walls of the Medical College of Wisconsin, someone whose work has profoundly shaped the health and well-being of communities across our state and well beyond. As President and CEO of MCW, Dr. John Raymond guides one of Wisconsin's most vital anchor institutions with vision, integrity, and an unwavering commitment, educating more than half of Wisconsin's physicians, advancing groundbreaking research, and improving the health of millions each year. Dr. Raymond's impact is not measured solely in numbers. It is reflected in the lasting partnerships he builds and the culture of collaboration he fosters. His leadership strengthens both our communities and our economy. His dedication to the social determinants is foundational to achieving health for all. As a nationally respected physician, scientist, educator, and community leader, Dr. Raymond brings not only deep expertise, but also a profound commitment to service. He understands that advancing health requires collaborating with communities, institutions, and individuals to ensure that everyone has the opportunity to thrive. Yet what truly defines Dr. Raymond is not just his strategic vision or his ability to lead at scale. It is his heart as a teacher. He is a true educator in every sense, whether guiding future physicians, shaping institutional culture, or mentoring individuals. Dr. Raymond leads with wisdom, humility, and a deep belief in the potential of others. His mentorship has shaped my own journey, and I know I am just one of many who have been inspired by his example. Please join me in welcoming a visionary leader, a devoted educator, a champion for Wisconsin's health and future, and a tireless advocate for health, Dr. John Raymond.
Thank you so much, Holly. It's really an honor for me to be here. And I want to start by expressing gratitude to you for the invitation. Kent and Mary, thank you not only for the invitation, but for helping to shape the future of our region through the Rotary Club. Thanks to all the Rotarians. I also want to thank my colleagues from the leadership team who are here today, and also thank the veterans who've served our country. I've been a VA physician for 43 years, and I just finished my annual service on the nephrology wards at the Milwaukee VA Medical Center a couple of days ago, and it's really the highlight of my year and an honor to serve those who've served us. So I'm just going to start off by admitting this may sound like a shameless infomercial about the Medical College of Wisconsin, but I hope by the end of this you'll recognize the heart and the humility and the character that we have at our institution and the value that we bring every single day to this community and to the country. So I want to talk about our vision for health for all, the power of the knowledge economy. So a little bit about MCW. We were founded in 1893. We're now the third largest private medical school in the country with nearly 1,100 medical students, 1,700 students, and a huge physician practice that sees, and growing, 5.2 million patient visits last year. We have campuses in Green Bay, Wausau, and Milwaukee. And I want to say we couldn't do it without our essential partners. We are a partnering institution. Children's Wisconsin, Versity Blood Research Institute, Freighter and Theta Care, as well as the Milwaukee VA Medical Center are our key partners. So we're an economic engine. We're not just a little old medical school. We generate a $6 billion economic impact in the region, creating nearly 40,000 jobs. 60% of our graduates stay here in Wisconsin to practice, and many of them practice in underserved urban and rural communities. And we have a very large research enterprise, huge, and I'm going to talk about that in a little bit, that generates $8 for every dollar of extramural grant funding that we bring into this community. We do have an impact outside of Milwaukee in terms of job creation, 300 jobs created at our central Wisconsin campus and almost 700 jobs created at the Green Bay De Pere campus. So as I mentioned, we have a huge physician practice, almost 2,000 physicians and 2,000 advanced practice providers. We are the largest single employer of PAs and advanced practice nurses in the state of Wisconsin, one of the largest in the country, actually. And again, 5.2 million patient visits this last fiscal year. We also have a huge research enterprise. Our scholarship is ranked in the top 4% of universities worldwide. We have a very productive faculty, and we have research that spans from molecules to populations. We have really invested in our clinical trials capacity over the last 6 to 7 years, and we now have almost 4,500 patients enrolled in clinical trials. In addition, we have 5,000 active research projects ongoing today. We are Wisconsin's largest private research institution with $424 million of research-related expenditures last year. That ranks us as number 79 out of 20,000 research institutions in the United States. We do as much research as recently inducted members of the AAU do. If we were a comprehensive university, we would be eligible for that heady group of peers. Our economic impact from our research enterprise is nearly $1 billion, $826 billion last year, and almost 1,300 clinical trials. So we take basic discoveries and we're committed to translating those into clinical trials, new treatments, and cures for diseases. Our innovations do have a global impact. We had 55 new discoveries and invention disclosures in this last fiscal year alone, with over 400 active technologies covered by nearly 600 pending or issued U.S. patents. And I'm going to talk a little bit about our innovation over the last 10 years, 510 invention disclosures, 86 licenses, and 22 startup companies. I know people focus a lot on translating these ideas into tangible benefit for the community, but I want to go back to the value of that $424 million of research expenditures. If you use a simple 2.2 times multiplier, that's almost $1 billion of annual economic impact on our region. Plus, that research enterprise is a talent magnet. It helps us bring world-class physicians and scientists here. It brings a high caliber of students to be in our enriched learning environment. And we have nearly 700 industry partnerships, and those are growing. Here's just an example of some of our spin-out companies, companies that focus on advanced imaging tools for treating brain tumors, medicines to guide tailored treatments for pharmacogenetics and precision medicine, making invisible vascular injuries visible, developing protein-engineered drugs for various chemotherapies, tumor imaging, pioneering treatments for laryngeal reflux, transforming imaging guidance with wearable image technology, and creating a drug that can reverse diabetic cardiovascular disease. This is just a small sample of the work that is being done by our faculty. I also want to say that MCW was a key player in Wisconsin's ability to compete for a $49 million economic development grant from the Economic Development Administration. And one of the drivers is here in the audience with us today, Dr. Mara Lord. Mara, thank you for your leadership and your persistence in showing the value of the Medical College of Wisconsin as part of this statewide collaborative. We are committed not just to serving people, but to transforming the way we deliver healthcare. As I mentioned, MCW has a very substantial clinical enterprise operation. We invested $35 million in that operation last year. We rank #1 in Wisconsin for clinical trials. The only institutions in the upper Midwest that do more clinical trials than MCW are Mayo and Northwestern, and we're catching up to them, and that's one of our goals. And as I mentioned, the overall research impact here is close to $1 billion. I want to talk about our commitment to the people who need us the most, the people that live in underserved urban and rural communities who suffer from disproportionate burden of health disparities and inequitable and unacceptably bad outcomes. So we are growing rural physicians in Wisconsin. In 2015, we opened the first new medical school campus in Wisconsin in over 100 years in Green Bay, and followed that with a campus in Wausau in 2016. The idea was to immerse students completely in a rural serving region that has sophisticated healthcare delivery systems to recruit students from those areas who say that they want to serve in underserved areas. And I can tell you the model's working beautifully. Half of the graduates of those campuses have chosen to stay and practice in rural Wisconsin. A remarkable track record, and one that many people said simply could not be done. There were so many disbelievers in this model when we started it. 100% of our graduates from the Green Bay and Central Wisconsin students have matched in residency programs at some of the finest institutions in the country. Washington University, Duke University, University of Michigan, Harvard, and Yale. And the beauty is they go to those great places and they come back here to practice in rural Wisconsin. We're so very proud of that. 113 newly minted graduates from Central Wisconsin and 184 from Green Bay. And we do place a premium on Wisconsin students and students from the Midwest when we do admissions. And one of the really interesting things about our admission process for those rural campuses is that we involve the community. They're actually part of the admissions committee. First medical school in the country to do that, and it works. And the simple question that they ask themselves is this somebody that I would like to take care of my patient, to be my neighbor, to be the doctor that I trust in my community? And so that's working really well. I also want to mention our commitment to mental health. There is a huge shortage of mental health providers across the state and indeed across the country. The burden of mental health is staggering. And we don't have enough providers, especially in the Northwoods. So MCW did something also that was a first in the country, a bold vision, and something that people said couldn't be done. We created distributed, rurally based residency programs in mental health in central Wisconsin and northeastern Wisconsin. Within 6 months of initiating the process of starting these residencies, we had accreditation and we filled our classes with high quality applicants. In fact, they were shockingly good as the ones we get at our Milwaukee campus. Now we've graduated 35 mental health providers, psychiatrists. 28 of them have decided to stay in Wisconsin. 25 are practicing in rural Wisconsin. That has increased the number of mental health providers at the doctoral level in Wisconsin by 30%. This is really a tremendous contribution to our state. These people developed free mental health clinics, and they opened a child and adolescent psychiatry rural training track in northeastern Wisconsin for our students and our residents on this campus who want to learn more about practicing rural mental health. Even here in Milwaukee, we have areas that are suffering from physician shortages. This is the health provider shortage areas, and you can see in the light blue are the shortage areas in our Milwaukee on the north side for mental health shortages, and in the green on the south side for primary care, and right in the middle, shortages of both primary care and mental health providers in the biggest and most important city here in Wisconsin. So we're partnering. I mentioned that we're a partnering institution. We started new family medicine residencies focused on the African American neighborhoods on the near north side of Milwaukee and the Latino neighborhoods on the near south side of Milwaukee. Our partners are the Outreach Clinic in northern Milwaukee, and on the south side, Freighter Health opened a new clinic. This is creating slots for 38 family medicine residencies on the near north side. These are people that say they want to practice in underserved urban areas. They're committed to that and they want to learn in those areas. And 18 residents on the south side, cut from the same cloth. the service mindset. And I want to talk about addressing clinician shortages. We have a crisis in the United States right now. Not enough doctors, not enough nurses, not enough respiratory therapists, not enough pharmacists, not enough people that serve the support services at the bedside in hospitals and within clinics. We have a crisis, and it was made much worse by COVID. Early in the COVID crisis, people came out of retirement. They delayed their retirement to serve. Nobody wanted to be called heroes, but they were. But over the last 4 or 5 years, healthcare providers have become demonized, and they didn't ask for that either. So people are leaving healthcare professions in record numbers right now. We can't train enough people to replace those who we are losing, the knowledge, the experience, and the raw numbers in the workforce. So MCW is taking very seriously our role as the health sciences university in the state of Wisconsin. So we have 21,000 living alumni. 99% of our graduates from our recently started anesthesia assistant program in Milwaukee have jobs in the field, and almost all here in Wisconsin, many at our competitors. That's what we're here for. We're here to create the workforce. We have 36 different graduate school degree programs spanning the gamut from ethics, bioethics, public health to basic sciences. And 31% of our MD graduates have chosen to stay in Wisconsin for their residency training. That's key. If a student goes to a medical school and serves in a residency program in the same state, they're 75% likely to practice in that state. So we need more residency positions so that we can retain our homegrown talent here in Wisconsin. We have 1,700 students, almost 1,100 medical students, almost 500 graduate students, a small but mighty pharmacy school, and 53 anesthesia assistant students. And that we were the 12th anesthesia assistant program in the country because there is, believe it or not, a shortage of anesthesiologists in the United States. And I'm going to talk about investing in the knowledge economy and why this is important for the health and well-being of our community. As you can see, disease costs us a lot of money. It costs us money and lost opportunities for employment, a diminished workforce, a less productive workforce, the cost of health care, and shortening of productive lives. And you can see just some examples here. $208 billion for cardiovascular disease, and for cancer, $1 trillion plus for both cardiovascular disease and for Alzheimer's disease. Just as examples, these are opportunities, these are targets for better treatments, for prevention, and better therapies. And we've done well in the US. We've saved 4 million lives in the cancer area, 56% reduction in cardiovascular disease mortality, and we have 70 plus drugs in the pipeline to deal with the ravages of Alzheimer's disease. MCW is participating in all of that activity. And I want to put a human face on the work that we do. This is Dr. Anna Palatnik. She's an associate professor of obstetrics and gynecology, and she's committed to improving outcomes and health risks after pregnancy. She's very focused on Central City, Milwaukee, where African-American women and their children suffer from a 5 times higher rate of mortality during pregnancy and the perinatal period. And she just received a multi-million-dollar grant from the National Institutes of Health just last week, which is remarkable considering all of the uncertainty about the NIH budget and concerns about attacks on ideology that spill over into health disparities research. So this is one of our best and brightest people, and she's committed to Milwaukee. We also really are leading the way in new discoveries that are translated to treatments. We will be the first proton therapy site in the state of Wisconsin. That should be opening within the next 12 months. It'll be based at Froedtert, and it'll serve Froedtert Children's in the entire region. We were singularly leaders in translating CAR T therapy into something that could be developed locally on a benchtop and delivered to patients customized to their cancer care. And we also are leaders in severe combined immune deficiency screening and testing here, right here in Milwaukee. So I just want to close by playing a video from one of our outstanding scientists, Peter LaViolette. He'll just be talking for about a minute about the work he does. He's a professor of radiology and imaging sciences. And I think, as you heard, we have a very strong focus on imaging technologies at MCW. He also trains AI to predict prostate and brain cancer.
Currently, the MRI technology that's used by radiologists and clinicians to track tumor in brain cancer can sometimes miss areas of active tumor that are infiltrating into normal cortex. Our research is focused on brain cancer imaging and improving the imaging technology that our patients go through during the course of treatment. We recently landed a big grant from the National Cancer Institute that is a collaborative study with colleagues at UCSF. They've developed AI models that have been trained with early brain cancer imaging. We've developed AI models that have been trained with late imaging, meaning the patients have undergone a series of treatments. And the goal of the proposal is to merge the two AI models into one universal tool that can track and identify different stages of treatment throughout care for our brain cancer patients.
And I also want to make sure that you know MCW is a research, clinical, education, and community powerhouse. In addition to having world-class people, we have a heart and a soul and a conscience and a mission and a vision to serve Milwaukee and all of Wisconsin, especially the people who need us the most. Thank you.
Thank you so much for spending some time with us today, Dr. Raymond. We'd like to open up the floor for questions. If you have a question, please start off with an introduction.
Thank you for being here, Doctor. Tom Gale. I'm a pretty staunch conservative, but I find it very strange that Robert F. Kennedy is Secretary of Health and Human Services. I would think it would be someone with your credentials. What are your thoughts?
Well, let me just say, as president of MCW, I'm supposed to be mission-focused and apolitical. But I don't have a lot of confidence in Secretary Kennedy's ability to discern gold standard science from fluff. And so I am very concerned. So I'll just say that I'm skeptical. I was shocked when he made an announcement in early April that after many, many decades of science, that by September, there would be a singular cause of autism that would be announced to the public. Science does not work on a schedule. It doesn't comply with a calendar. I'll keep an open mind, but I am very skeptical. Thank you.
Hi, my name is Hannah Paul. I'm a former occupational therapist who left the field for tech. I knew that the quality of life I'd get in a tech job versus healthcare, with you needing to get CEUs to maintain your licensure, that doesn't always mean to a different change in pay and things like that. So I'm curious how you're addressing the problem of healthcare jobs being not sought after by new generations coming. And then second, you spoke at my Forward 48 first session back in April 22 about the Thrive on King project and the power of how you listen to the community members for years to build that project, to make that the foundation of what you're building, something that the community wanted. So could you speak to that as well?
Yeah, by the way, Hannah, thank you for remembering that. Getting back to having a heart and a soul and a conscience and being humble, the Thrive On project in Central City, Milwaukee, really was birthed with conversations that happened after the Sherman Park civil unrest that I had with our people that lived in and around Sherman Park. Those conversations were happening on a monthly basis and eventually started to bring in community leaders. And so we listened to the community about what they wanted from MCW. And it was not to come in thinking we had all the answers, but it was to be there and to be there for a generation. And so Thrive On eventually came to partner with the Greater Milwaukee Foundation. They know how to economically empower neighborhoods. We know about the social determinants of health and healthcare, so it's been a beautiful marriage. And we had an African-American development company redevelop the old Gimbel Schuster store. If you haven't been to Thrive On, it's been open for almost a year and a half. Go there. You want to feel good about Milwaukee. You'll see people of every occupation, every generation, every race, every ethnicity smiling, people interacting with hope, going there for a nice breakfast at the Kinship Cafe, learning how to write a resume and to be job re-skilled, to donate blood. It's just an amazing facility. And if any of you have good memories about the Gimbel Schuster store, you can see what it's become. Now, in terms of people not wanting to go into healthcare, I understand that. The work is hard, the pay is good, but you're not going to become wealthy in healthcare. Even if you're a cardiothoracic surgeon, you don't start really making money until you're almost 40 and you have a lot of debt and deferred gratification that many people aren't willing to undergo. And healthcare workers have been demonized over the last years, and they continue to be demonized. To be told that we lack integrity in the peer review process or that we get kickbacks for COVID, out and out untruths, but they stick. And it hurts. But I will say, Hannah, MCW has no trouble filling our medical school class. And we had 12,000 applications for 270 spots. We can only interview 600 or 700 students. I would hope that occupational therapy and physical therapy and respiratory therapy and pharmacy and nursing continue to bring the best and the brightest who want to serve our communities. So we have to deal with this demonization and we have to deal with burnout. I'm hopeful that artificial intelligence will actually help take the provider's hands off the keyboard and their eyes off the screen and back on the patient. So that's my hope for the future.
Hi, my name's Chris Hinrichs, and Hannah kind of teed up the Thrive on King project for me. Could you talk a little bit about specifically what your staff is doing there? And I have this vague recollection that you have medical students in residence in the apartments, is that correct? And maybe you could talk a little bit about those direct services that are going to that neighborhood through that transformational project.
Yeah, thank you for the question. We have always had hundreds of people that work in the community. They were scattered all over Milwaukee until the Thrive On project. So they've all come together. We hope to bring synergies by interacting with each other. We have our Center for AIDS Intervention Research. We have our Community Engagement Corps for the Cancer Center. We have our General Internal Medicine Division that does community-based research there, and a host of other individuals from our Institute for Health and Humanity, which is our equivalent of a School of Public Health. We have learners there. We were just had a site visit from the Higher Learning Commission to accredit that site for teaching. That's the institution that accredits MCW and all the educational programs that we have. And we do have students that are actually living in the apartments. This is called our Health Equity Scholars Program. 5 students, full ride scholarship. They were chosen from students who were already admitted to the medical school class, high quality students who said, I want to practice in an urban setting, and in order to learn how to do that, I need to live there. So they're actually living in the Thrive On building. So it's a very exciting concept. I believe one of a kind concept in the entire country.
Hi, I'm Erin Richards. I have a question about asking a little bit more detail about the current status of your federal budget cuts or federal cuts to research funding. I'm really worried about that because we're not going to feel some of the full effects of those kinds of cuts until much farther down the road when there's a different lineup of politicians in office. But I'm wondering if you could talk about, is anything still tied up in the courts? Is it still the $5 million that you're out? Is there anything coming back? And then on the other side of the coin, you guys did a first ever cancer ride this summer to raise money for cancer research, and I wanted to just give you a chance to talk about what that raised for your cancer research initiatives.
Thank you so much, Aaron. We did open a new cancer research building on August 5th. Governor Evers was there. It's a 160,000 square foot building totally dedicated to cancer research. So our research enterprise, we plan for it to grow. So thank you. We had a first of its kind bike ride to support the cancer research here, not just at MCW, but with all of our partners, Versity, Children's, the VA, and Freighter. It raised over $1 million. MCW's only had one event in our history that had raised $1 million before this. And so pretty remarkable for a first-time event to do that. Now, I'm going to try to be apolitical again, but it's going to be challenging. President Trump proposed a 40% cut to funding for the National Institutes of Health and similar cuts to other research arms in the Department of Defense, Department of Education, the National Science Foundation. For the NIH, that would be an $18 billion cut. And if you think about it, grants come in 3 to 5 year tranches. If you have a 40% cut, you cannot give a single grant for a year, and you still have to cut grants that were already awarded, where there are sunk costs, where there are people that have been hired up, where there's work in process. That was a huge threat and something that we had to do some very significant scenario planning for at MCW. Actually, some of the people doing that work are right here in the audience. Fortunately, initially there was a significant slowdown in the awarding of grants. That pipeline seems to be opening up. We provided bridge funding for our outstanding scientists who are in limbo. And right now, it looks like the NIH budget may end up being about what it was last year. The Senate version of the budget had a $450 million increase from last year, which is very modest, but it was still an increase. And the House version that was just announced this morning has a $450 million cut. So it'll probably end up somewhere in the middle when they do reconciliation. That is a lot better than an $18 billion cut. And let me just say this. America's biomedical research platform, driven by the National Institutes of Health, and the partnership that universities and the NIH have created over the last 50 years, is the envy of the world. It is the most effective and most efficient biomedical research platform ever conceived, and it's under threat. It's under attack right now. So I'm hoping that we'll continue to have a bipartisan investment in the value of research. Thank you. And if we don't, it isn't just going to be that MCW's research enterprise will shrink. We will lose an entire generation of scientists. To get back to what Hannah was saying, we're hearing the same questions about, is it worth going into science? There's enough uncertainty as it is. With all the attacks on the value of science, do people really want to do that for a career? So Aaron, thank you.
My name is Jeff Smoller. I retired back to Milwaukee from Madison, where one of my jobs was to facilitate the Wisconsin idea to connect science, policy, and practice. I didn't always succeed. I want to commend you for a Milwaukee ideal that complements the Wisconsin idea. You're very to be commended. My question is on research in relation to mental health. And we were introduced today to the need for gratitude on the part of all of us. And if one of the root causes of youth mental health is kids don't think they matter, they don't belong, they're lonely, they have nothing to be grateful for. What thoughts do you have in terms of an institution such as yours, committed to the community, in research, in practice, and policy that relates to this crisis we're facing with youth mental health?
Yeah, great question. And I don't know that I have the best answer, but partnership, building bridges and trust for the people who need us the most is really, really important. We do have strong adolescent and child psychiatry providers and researchers in partnership with Children's and Freighter that are leaning into the crisis. And I will have to say, the answer is not in the doctorally prepared PhDs, psychiatrists, psychologists. It's in grassroots community caring about the kids. It's about all of us It's about everyone who touches the lives of kids. And we have so many resources in this country. I think we can do a better job of drawing attention to the mental health crisis, to the loneliness that kids are feeling, the disconnection that I think is created in part because of social media, the lack of empathy because of social media. Those are all problems that some of our faculty are working on. So thank you.
I think I'm the last question. Hi, my name is Antoine Carter. My partner is actually in medical school getting ready to finish her degree to become a chiropractor. She is extremely nervous as she's currently in school with all of these cuts going around, especially the student loans. Is there any mechanism in which the medical college is thinking or addressing how to develop a pipeline for students of color and or not color as they go through this weird time where she feels like she needs to rush to finish school? Also, I don't want to pay that bill, so.
I'm glad you're so committed to her. Look, you've raised a really important issue. One of the initiatives of this administration has been to simplify but reduce the availability of student loans, especially at the graduate level. The Grad Plus loans are under threat. These are loans where you don't need a co-signature, and they'll pay for living expenses, not just your tuition. There's going to be a cap put on total borrowing that is less than the cap to go to a school of chiropractic or osteopathy or medical school or pharmacy school. So the students are going to have to go to the private market for loans. They'll get loans. They won't all be usurious, but the conditions and terms will be less favorable than the government-sponsored loans will be. I think that's a problem because people that have wealth, that maybe aren't first-generation students, college grads, that aren't from rural areas or from underserved urban areas, they're going to have an easier time finding resources than people of color or people from rural Wisconsin, or as I said, first generation, or immigrants. We benefit from the richness of diversity in our society. The current attacks on DEI notwithstanding, we're better together. And I am deeply troubled and concerned that basically to go to medical school, you're going to have to already have significant wealth to be able to make it through. It's 3 or 4 years of medical school. It's 3 to 6 years of residency program. You've got $300,000 or more of lifetime debt before you earn your first paycheck. A lot of people aren't going to be able to do that. So thank you for your question. And look, being a chiropractor is a good profession, so you're smart to invest in your partner.
Thank you very much.